Understanding jaundice. A yellow hue. Jaundice is a common condition that causes a yellowing of the skin and the whites of the eyes. This yellow discoloration happens because of a buildup of bilirubin in the blood. Bilirubin is a yellow pigment that is produced during the normal breakdown of red blood cells. Usually, bilirubin is processed by the liver and removed from the body. However, if there is a problem with the liver, or if too much bilirubin is produced, it can build up in the blood and cause jaundice. Jaundice can affect people of all ages, but it is most common in newborns. In most cases, jaundice is a harmless condition that goes away on its own. However, in some cases, it can be a sign of a more serious underlying medical condition. Unmasking the causes. Why does jaundice occur? There are many different things that can cause jaundice. Some of the most common causes include liver disease. Liver disease, such as hepatitis, cirrhosis, or liver cancer, can damage the liver and prevent it from processing bilirubin properly. Gallstones. Gallstones are small, hard deposits that can form in the gallbladder. If a gallstone blocks the bile duct, it can prevent bilirubin from being excreted from the liver. Hemolytic anemia. Hemolytic anemia is a condition in which red blood cells are broken down faster than they can be produced. This can lead to an increase in bilirubin production. Newborn jaundice. Newborn jaundice is a common condition that affects about 60% of newborns. It is caused by the baby's liver not being fully developed at birth. A glimpse inside how jaundice affects the body. To understand how jaundice affects the body, it's helpful to understand how bilirubin is normally processed. When red blood cells reach the end of their lifespan, they are broken down in the spleen. This process releases bilirubin, which travels to the liver. The liver then converts bilirubin into a water-soluble form, which is excreted in bile. Bile is a fluid that helps digest fats. It flows from the liver into the gallbladder, where it is stored. When needed, bile is released into the small intestine to aid digestion. If there's a problem with the liver, gallbladder, or bile ducts, bilirubin can build up in the blood. This excess bilirubin is deposited in the skin and eyes, causing them to turn yellow. Section 4. Recognizing the signs. Symptoms of jaundice. The most obvious symptom of jaundice is the yellowing of the skin and whites of the eyes. This yellowing typically starts on the face and then spreads to the chest, abdomen, and legs. Other common symptoms of jaundice include dark urine, pale stools, itchy skin, fatigue, abdominal pain, loss of appetite, nausea, and vomiting. If you experience any of these symptoms, it is important to see a doctor to determine the underlying cause. Section 5. Treatment and care managing jaundice effectively. The treatment for jaundice depends on the underlying cause. In cases of mild newborn jaundice, phototherapy may be used. This involves exposing the baby to a special light that helps break down bilirubin. For jaundice caused by liver disease, treatment will focus on managing the underlying condition. This may involve medications, lifestyle changes, or in severe cases, a liver transplant. If a blockage, such as a gallstone, is the cause, surgery may be needed to remove the obstruction. Nursing care for jaundice focuses on supporting the patient and managing their symptoms. This may include monitoring vital signs and fluid intake and output, providing a healthy diet and encouraging hydration, administering medications as prescribed, providing skin care to relieve itching, and educating the patient and their family about jaundice and its treatment. Understanding jaundice, its causes, and its management is crucial for both healthcare professionals and the general public. Early detection and appropriate treatment can often prevent complications and improve outcomes.